are two areas of the body that will benefit from decompression, and that is going to be the OA joint, or the Atlanto-Occipital joint, between the occipital bone and the first cervical vertebrae, and L5-S1 in the lower back. So what happens is the occipital bone is a convex surface moving on a C1 concave, and so you've got a posterior roll, anterior glide when you have a forward head and you've got a poor posture. So gravity is going to pull you in this direction. We want to restore this direction. That's going to be a posterior glide. So we will be in position to restore that posterior glide. Then with the lumbar spine, you've got L5. It will move forward on S1, and that's a spondylolisthesis. So that is the cartilaginous joint between L5 S1. We want that L5 to come back, so that's going to decompress the facets. Those facets are the plane joints that are going to glide up and glide down, and when they're better aligned, that glide is restored. So what I like to do is get into an astronaut position and decompress those two areas of the body. I'll spend 5 to 20 minutes in this position, and it's a great way to get patients to decompress these areas to help restore alignment and also help with chronic pain, as we've talked about how those areas in the nuchal fascia and the thoracolumbar fascia have high sensory, and especially with the fibers from the sympathetic nervous system in the vicinity. A lot of people with stress can carry a lot of tension there, and that changes that the positioning, and so we want to restore the glide there. To do that, I've got an ottoman. I want to get into a 90-90 position, bring my legs up over the ottoman, and then I'm going to use a pull noodle to support my cervical spine and allow my occiput to come back over C1, so that first cervical vertebrae. So that's going to bring the posterior glide. And then in this position, I just will have my patients relax. You do not want to contract the abdominals. You're just resting and letting the body use gravity to restore the glides in those two positions. So this is the L5-S1 and the OA, or the Atlanto-Occipital decompression, to restore the glide, the arthrokinematic movement for those areas of the body.